This is Dr. Meyer with our weekly video blog. This week I'd like to talk about statins. You've heard about statins, simvastatin, Lipitor, which is a aorostatin, and there's about 4 of these on the market, and they've all become generic over the years, and that brings the price down from in the hundreds per month to some of them are now $4 a month or $10 for 3 months supply at the discount houses such as Sam's Club, Walmart, the Target, and Costco are the 4 discount houses in this town. And they've been, drugs have been down to $4 a month. There's about 300 of those on the list, which has vastly reduced the cost of medications. When I got my last set of medications, between my wife and I, we had 8. 3 months supply of all 8 of them was $80, and there's not even any tax on that. And when we send out to the mail order pharmacy, the price is sometimes $800–900 for the same mailing. So that's a rather significant improvement. Well, statins are used to reduce the cholesterol in your body, or the triglycerides. And for a while they're very popular here, 10–15 years ago, and there's not a person came back from a cardiac consultation that wasn't on a statin, and that was going to be the thing that prolonged life. Well, my cholesterol wasn't very high, but it was around 210, 220, which is slightly above normal. So my doctor thought he would start me on one of the statins. I think it was Zocor. And well, within about 3 months or so, I started having aches and muscle pains and joint aches. And by the time 9 months were around, I could hardly walk. And so I stopped taking it and started doing some research on it. And it affects the muscles and joints, and it can actually destroy the muscle, and it's called rhabdomyolysis, where the rhabdo, that's striated muscle, actually disintegrates, but then it has to be excreted through the kidneys, and so your kidney test, CPK, should go up from muscle deterioration. And then you have your kidney function go up, and so one could get into kidney failure, and that's rather significant. It certainly scared me rather quickly, and I can't imagine myself being on renal dialysis for the life, messing up 3 days of my week. So I got off of it, and I just went on a low cholesterol diet. And what I did, I cut the beef out of my diet. Red meat is a big part of cholesterol. And of course eggs, brought that down to 1 a week, bacon to 1 a week, milk down to 1%. Some people have 4%, 2%, but you know, from 2 to 1% you're cutting out half of the fats in your milk. And then no butter, and my doctor had me put flax on my cereal. Flax is very effective in reducing cholesterol. Those 5 things brought my cholesterol down from a little over 200 down to 150. So I don't worry about having a coronary in my lifetime, which would be a very common thing in my family, people dying from strokes and coronaries, because my cholesterol is very low. And so there's other things that might get me, but I feel pretty confident that the heart attack and the strokes won't get me for at least 20 or 30 years. And when I'm past 100, it won't matter. But so that's the basic diet, and I bring this up to most of my patients, and they say they think they can bring their cholesterol down without medications. And I see them then 6 months later, and we do another lipid panel, and they may be even worse. And I find out that they really haven't reduced their beef, and they're still eating 3 beef tacos and 2 beef hamburgers every week. And you know, one has to be very rigid about it. And I don't touch beef, even in a restaurant or at home or any place. And so I keep my cholesterol intake there very low. And so the meats, if you have high cholesterol, would be basically chicken, turkey, fish, And when you need that steak, make it a pork steak. And then, of course, fish. And fish is very important. One should have a fish meal every week. Fish actually once a week is said to reduce your chances for coronary by about half. And of course, I work in a Catholic hospital, and they have fish every Friday. So I get a good one fish meal a week right there during the lunch, which is Friday noon grand rounds, and so it's very pleasant to eat fish there. So there's a lot of things being said about cholesterol and high lipids, but if you put that into Google, you'll find out the whole raft of things coming down and all the problems, and we're seeing more and more of the cautions here for the bombshell of disastrous side effects from statins. And these are things we didn't see a few years ago, and I'm not sure how the cardiologists take that, but in addition to rhabdomyolysis, high cholesterol, the cholesterol pills, the statins, are said to reduce memory. And that's a very big concern in our day, losing memory, and are we on our way to Alzheimer's? And the cardiologists have gotten so many coronaries bypassed, everybody's living so long, and you know, my patients that are 80 look like the ones that were 60 when I went and practiced 30 years ago. So we're living long, and so we're getting the complications of the brain. We're getting neuropathies from the statins. The nerves in our legs cause numbness, and we don't feel as well, and that makes us unsteady on our feet. And there's just a list of, you can hit the web and find just whole columns of side effects, 20, 30 side effects from the statin. And we're just not a detailed course on that, so it's really readily available. So the key message, take-home message, is that anybody can do it with diets, as far as I'm concerned. And even if you have type 4 hyperlipidemia, where it's your triglycerides that are high instead of your cholesterol, the same drugs work, but then in those nicotinic acid or niacin might be even more effective. And if you take niacin, be sure to take the long-acting one, the slow-acting, slow niacin, and be sure to block the side effects of that with an aspirin tablet an hour beforehand. Make sure that's a coated aspirin so you don't bleed in your stomach. And that's it for this week. And be sure to subscribe to my channel, and put all your questions and comments in the box below. So until next week, take care.